So hi Rich, how you doing? So you come back for your 6-week top-up session after your initial course of 20 IDDs. So how you feeling?
Great, very good indeed. Get the odd leg pain from, every now and then, but no, it's very good indeed. Excellent. I think after about 15 treatments, when I was going to throw in the towel and said I had enough, no, it began to work for me.
It can be different for everyone, depending on what kind of injury, the nature of the disc, the health of the spine in general. Some people can come off the first one and they feel absolutely fantastic. Whereas some it does take longer, especially if you've got a larger disc bulge or it's slightly older, it's not as new or recurrent as a fresh bulge is. But typically it seems to be about 10 is the turning point for most people, up to about 15. But yeah, once we hit that stage, I think it was full on.
And it was good that I could go and tell the surgeon I didn't need an operation.
Exactly, and that's what we want at the end of the day.
That's what I wanted.
Okay, good. I mean, you came in and saw us about, 3 months ago, and as we can see here, got a rather medium to moderate L4 disc extrusion that we can see right there. But it seems to be after about the 10 mark, you started to feel, the good signs of the IDD. And pushing more towards the 15, 16, it started to really resolve itself, and that's when it took off.
Absolutely, yeah. No, I had an awful lot of leg pain and sciatica up to about 15, and then all of a sudden...
hit that magic number, and here we are today. This is the first of the 2 harnesses that we'll use. So this is the shoulder harness. This is what will keep Richard steady when the force is applied. So it will keep his top half still, while his bottom half is allowed to be pulled down the bed slightly to get that distraction in the disc that we desire. So the next thing is to keep the legs elevated. There we go. So now we attach the pulling force to the ring. So this is where the main tension will be applied from to the harness in a nice even manner. Okay, head up 1 second, Rich. Cheers. So this is the part of the harness that will keep Richard nicely strapped down at this side of the bed. Just bring your shoulders over a little bit, Rich. So as we know, this is really, really important that you're even on both sides so that the force is applied the same on both. How's that feel, Rich? All good?
Yes, great, thank you. Once you get on there's no pain or anything, you just lay here, very comfortable. So, no, not a problem.
I guess you get used to the setup procedure quite quickly.
Yes. The other good thing, you can keep your clothes on.
So we'll just blow out that cushion so you have your neutral spinal curve there. How's that feel?
Fine, that's good, yep.
Okay, so it's been 6 weeks since your last session. So obviously we'll take some of the tension off this time. So we'll go to £93 today. And that's what we'll be using. Just make sure that the bed is level. That's perfect. And as we know with you, Rich, we need to target the L4 disc for you. So that means an angle of 10 degrees for us to use here. Especially by changing the angle of the force application, we can actually target an individual disc. So for Richard, we know we need about 10 degrees to hit his L4. That's perfect. That's spot on. Okay, the last thing we've got to do is harness Richard down with the chest strap. Nice and tight, but allow him to breathe. That's perfect. So deep breath for us, Rich. And up. How's that feel?
That's great, yeah, no problem.
Nice and tight. Just check that you're in line. That looks perfect to me. Okay, so over the next 25 minutes, we're going to get 13 1-minute cycles of the max distraction. So today it'll be £93 there, Rich. As we know, followed by each 1-minute cycle, we'll have a 30-second rest cycle, which is half of the max. For the first 4 minutes of the test, we actually keep the bottom part of the bed fixed. And what we'll do after 2 cycles are complete, we'll release the bed, and this part will be on runners, right where we lined Richard's hip up with the middle of the bed. And that is where the main distraction will happen, and thus the shoulder harness to keep him firmly planted at the top of the bed. There's nothing quite like this. It's very unique. I guess the closest thing you can find is manual traction, but it's not as specific or direct as this is. And obviously the only other alternative really for a severe herniated disc is something like surgery. But this is obviously the non-invasive option. This is why people like Richard and other successful patients we've had has found this machine and reaped in the benefits of it really.
There's nothing to worry about. Basically, you come along, providing you've got a scan, and I can obviously see what the problem is. I think this would work for most people. You just get it slightly tight on the chest where it's holding you down, slight tension in the waist, but it doesn't hurt at all.
I think you've even nodded off a couple of times, Richard.
I did actually, yes. It certainly worked for me, and I'm obviously older than most patients. I mean, you compare the pain that you get from sciatica to the odd little pain you get on this, it's nothing. I think people that have had sciatica will appreciate the pain they get from it, and people say, well, you look all right, I feel fine, but I've got this shocking pain down my back of my leg, and you can't walk properly, and and this is certainly non-invasive.
So we'll just release the bed now here, Rich, after the first 4 minutes, just like we always do. So the bottom half of the bed here is actually on runners, so that will now allow a bigger distraction when the force is applied, and allow it to be slightly dragged down the bed even further. So you should feel a slightly stronger pull there, Richard.
Yep.
But still not painful, still
no.
Walk in the park. The screen, basically a graph is being produced as the IDD is going on. It basically tells us the muscle tension that Rich is experiencing right now. So the machine actually has a range of sensors built in that can actually tell us how well he's responding to the tension that we put through. So for example, today's 93 is quite a high tension. It's looking into the kind of the latter stages of the protocol. We can actually see that Rich is responding very well. His muscles are allowing that full distraction and stretch to happen, and it's within a safe guideline to continue. Again, the machine's quite clever in the sense that if it does just detect something going on that it shouldn't, or a bit of an anomaly in the muscle traction, it will automatically shut off as well. But there's always a patient button there that they can use to shut the machine off, as well as one for myself.
So this is tracking down about half my body weight, isn't it?
It's like poundage off, and yeah, and we're away. Yeah, hitting the peaks, doing well. How's it feel?
Fine.
Was it a lawnmower, Rich?
Yeah, just lifting the lawnmower out of the shed, twisting my back, and that was it. Other chiropractic treatment, etc., that didn't really help. Operation was the only thing I was going to have, and looked on the website, found these guys, and never looked back really. I had several sessions, and you think, not really getting any relief from this. The guys obviously tried some acupuncture. That gave me some instant relief, but it was only short term. And I was beginning to get despondent, honestly, after 15. I said to David, look, I think I'm going to just pack this in because it's not really working. And he said, no, carry on a little bit longer. And I think it was 16 or 17. And I literally got off the bed and walked down to the train station thinking, I haven't got a pain. And it was great.
I guess it all starts with really reading the MRI, really understanding every person's problem and every individual patient's problem, so that you can tailor the protocol towards them. Yeah, you do need a whole understanding of the area and the lower back to really kind of get the most out of it for each individual patient. We get a lot of fairly young, maybe in their 30s, who are very active in sport, just a very, very active sporty kind of people who probably through injury, through their sport, through a knock or a fall or a tackle or something, gain a bulging disc or a herniated disc. And again, because relatively young age on their side, if it's a fairly recent bulge, it significantly increases their chance of it fully retracting and a full kind of heal. But I guess the other half are maybe like Richard, who are maybe slightly older and just have an unfortunate trauma point or accident through their time, and yeah, we kind of get both really. So it caters for everyone. It really does. I mean, we've had 21-year-olds and we've had 71-year-olds, all on the IDD machine. Well, that's what's great about the IDD. I mean, it is a new alternative to surgery. The high price initially can turn some off, and that's totally understandable. But for the sake of, I mean, you're looking at 1,600 for a full course of 20. 20 is the manufacturer's guidelines, and on average we find it's pretty typical that if you have a fairly moderate to large disc protrusion, that you will need 20 sessions. However, we've had some that have had less, but in the severe cases, some that have had more. And even if it doesn't necessarily gain 100% symptom free for the patient, it's an alternative to surgery, and it's almost a last resort for some before surgery. So in my opinion, it's worth that little more just to try and avoid lower back surgery, which at the end of the day no one really wants.
Surgery was the last thing I wanted. I did go and see the surgeon, and I was on my 16th, 17th visit then, and he said, well, you're walking fine. And I said, well, I'm feeling much better. He said, well, why have you come to see me? I said, well, I had an appointment 3 months ago and I'm here. But he said, there's no way I'd operate on you, but I'll give you a letter, and if at any time you want to come back, you can bring my secretary and get an appointment for an operation. He said, but I'd rather not do it because you may lose the use of your toes, and you won't thank me for that. So shook his hand and thank you very much, goodbye.
It's non-invasive. As you can see, it's very easy to undergo. It's not painful at all. You have to just pretty much lie down for half an hour, and I mean the total treatment time is 25 minutes. You'll come in first and receive an infrared heat belt for about 10 minutes just to warm and prep the tissues. The machine is 25 minutes, followed by about 5-6 minutes of ice. For the lower back, we do integrate a core exercise program about halfway through the protocol to really kind of strengthen the core muscles, to really hold that kind of spine intact and in place, and to stop any micro shearing or instability that there may be. And coupled with that, they really do complement each other. And again, if you get some muscular tension or any kind of soreness, the medical acupuncture is a great way to really, minimise that and to keep it at bay. So they all really complement each other really well. So the screen's telling us we're 15 minutes through the protocol, and it's showing that Richard's muscular response is very good. His body's allowing that full distraction to happen. There's no kind of resistance there, and it's very, very clean and consistent and smooth, which is exactly what we want. It's pretty much a model track, we call it, a muscular track.
I think that was one of the concerning parts for me, because up to 15, you were always saying, it's tracking well, it's looking good, but I wasn't getting any relief. And then all of a sudden, click, it happened. So.
Yeah, but that shows, if each session we accurately get the right amount of tension, and again, like I said before, we tailor-made it, this protocol to you, that it may take a slight bit longer, but you really do get the benefit from it after that. It shows that we've had a good protocol, we've had a good foundation laid with the tension, and now we're just rolling it out with Richard, so we're just keeping it going.
I mean, I get the odd twinge, I think anybody does. You get the odd pain occasionally, but that's my age anyway. But I can walk now, I can sit, which I couldn't do before. And it's great. I mean, I can sit for 2 hours in the cinema now, which I couldn't do before. It's been brilliant.
The next step will be, we'll see Richard in another 12 weeks from today, and then we'll see him every 6 months for the next year. So we'll see him twice in the next year, and providing Richard obviously is very aware of his posture, of lifting and bending, and he continues to keep in shape and take care of his core. He'll be absolutely fine.
I think the key thing to remember is that you do have a damaged back, and it'll never be 100%. But if you do the right things, as David says, and don't lift and bend the wrong way, then there's no reason why I can't continue to be fine.
We start with some very, very basic Pilates-based exercises. that we do a one-on-one session, really get Richards and the other patients to understand the application and what they will do each exercise, and then we just build on it. We start probably around 2 weeks after starting the IDD, and then we'll build up from there, and we'll add probably an exercise every time until we're about 10-15 exercises in total, and that will really shape and mould that core and really stabilise the spine.
To start with, because it was quite painful to do them, and then David said, well, just do the ones you can do to start off with. And there's still a couple I can't do because I think probably because they don't suit me, but the rest of them are fine. And we encourage almost every day to partake in the exercises. But again, once for example, Rich has finished his initial 20 now, if he conducts them 3 times a week, it's good practice, and it will do well for him. It will keep it going, keep his core strong, and keep his spine stable. And it's as simple as that. How's that feel, Rich? Are you sore at all? Or? No, absolutely fine.
Good. Perfect. I'll just remove the wedge.
Physio suggested the traction, but that I believe is still quite basic. This obviously has got much more to it, and they can actually target the right disc, in this case L4 and 5 for me, which on normal traction you can't do.
And that is what makes IDD so special. I mean, it's a much more advanced, precise form of traction. I mean, we can target an individual disc and put a very precise amount of pressure through that. Like the IDD, it's a very natural form to the body. We have what's called a sinusoidal waveform, and what it does, it adds the pressure over a minute in a very gentle and responsive way to the body that the body understands, that we can see here. So instead of manual traction where it's very direct and the force is either applied full and then it's taken away in full, this is very gentle to the body and not promote any spasming or anything like that, any unwanted side effects. Also, what we have here, which is again unique to the IDD machine, is the oscillation that we can see here. So when it reaches the max tension, it will reach a peak, today for example, of 93 pounds, and then it will oscillate between 5 pounds of pressure. So between, for today's case, 88 and 93 pounds. Once it reaches that, it will almost cause a pumping mechanism, which will really promote that nutrient exchange in the disc, and really give it a kick start to really promote it to try and retract that disc material that's been extruded. And again, that's it's very unique and very, very precise. I mean, it's not like you can feel it going on. So now I'll just give you some ice to finish the treatment. So yeah, as I said before, so you have 10 minutes of the infrared heat, 25 minutes on the machine, followed by 5-6 minutes of the ice, just to calm down that inflammation that could be caused by any of the little tiny micro trauma on the machine. But no, you're a bit of a veteran at this, Rich. So
yes, I had it about going back sort of 10 years ago, but then I was obviously younger, and I think it resolved itself after a little while. And then 2 years ago, where I had a problem again that got corrected by the chiropractor, was obviously kept me fairly flexible, but this time it wouldn't go away, and I had to go and see the surgeon, who I don't need to see anymore, which is great. I can just basically do anything now. Well, I had to think about what I could do, like can I drive the car today? Am I going to be in pain when I drive the car? Can I go and play golf? All the things that you do normally. Can I sit? I was for 3 months laying on the floor watching the television because I just couldn't sit. So the only comfort I could get was by laying down as I am now, maybe my legs up or my legs down. Again, with the chronic pain back of the leg, the only good thing about my problem was I could actually sleep. Laying down was okay for me. I could stand okay, but sitting was the most painful. Give it a try. I mean, you have nothing to lose. Yes, it may cost you a little bit, but in the end of the day, I think the majority of people that have the sort of injury that I've got could benefit from it.